one SSI can lead to additional costs of 60,000 rupees for healthcare cost per patient. And for patient, it can be 7,000 in and out of pocket expenses per day for patient. So it's a huge burden for patient. And we know that which indicates that India has roughly 1.5 million SSI cases annually. So it increases minimum on an average, it has been seen 7 days hospitalized days. Is 60% more likely to spend time in ICU, 5 times more likely to be readmitted within 30 days of discharge, and it is twice as likely to die. So you can well imagine the magnitude of the problem once the patient develops surgical site infections, what a patient has to undergo, not only the length of stay, also the ICU stay, and then the readmissions and the out-of-pocket expenses, and ultimately the death. So this outcome is never good if it is not taken care of. And we know, as it has been already discussed, that factors which are responsible for, but then once we go through the nerve from the nursing point of view, the factors which are responsible, patient-related factors, which first comes pre-operative bathing or showering. Now, many a times what happens, we tell patient that you take this antimicrobial solution, go and take bath, but we forget to explain how the bath has to be taken. We do not explain that. We do not take care of the operative side, how the microbial skin burden can be reduced if the bathing is being done properly and showering is been done. First of all, it has to be ensured that minimum 2 bathing has been done. When the patient gets admitted, or after admission, 1 bath is given and another bath is given after the clipping has been done on the day of morning of the surgery. So it's very, very important. And to ensure that clipping is also done within the stipulated time, I'm coming to that, that clipping is to be done within 6 hours of surgery, so that it helps in reducing the burden of microbial skin flora to develop. So, and then the next comes the managing underlying health conditions. As Dr. Pari also mentioned, obesity, diabetes, smoking. These are the situations where these are very, very high risk factors which can lead to SSI. So according to CDC, they also say that these burdens to be reduced. So we have to ensure that patient is being counseled about all this, and well control of diabetes has been done prior the patient is taken for surgery. So I think every hospital has come up now to understand that shaving is not the indication. Shaving should not be done. It should be the razor, and clippers to be shaving with razors should not be done. It should be clipping. So clippers are recommended for hair removal because because razors, we know that it can irritate the skin and it can open up the skin to have more chance of having infections. So after that, it is a patient factor also talks about perioperative glucose control. So it is perioperative, that means pre, intra, and post glucose monitoring, glucose control is very, very important. So every hospital should have a proper structured surgical site infection prevention checklist or bundle, which should have a range of glucose to be maintained per patient. That has to be intraoperative. That's very, very important message and important factor which needs to be regulated, which needs to be monitored constantly. Coming to the surgical environment and technique, where we have antimicrobial prophylaxis, as Dr. Pari was talking, so right time within, now we talk about that within 60 minutes of incision, the antibiotic has to be given. But it is 60 minutes means it may be 5 minutes, it may be 10 minutes, or it may be 55 minutes. But whether what is more important in that also, if you do minutely, minimum 20 minutes before, 20 to 25 minutes before the incision is given, we should consider that. It may be that formula talks about, or the guideline talks about within 60 minutes of incision, but it should not be that within 5 minutes, just I give antibiotics and within 5 minutes patient, the incision is being done. That is not a correct thing. Minimum 20 to 25 minutes in advance, the antibiotic should be given before the skin incision is given. That's very important, even though it is within 60 minutes, but this portion is very important. Now, maintaining normothermia is also very, very important point, which Dr. Pari has mentioned. So during surgery, whether patient is being warmed properly, patients, even the intravenous fluids that we are using, whether that is being warmed and before giving it, Even we say that skin preparation solution, suppose in the morning, first case we have taken, and the skin preparation solution is kept inside the OT with the what temperature of 16 to 17, or you see within 18-degree temperature, it gets cold, the normal temperature too, it becomes very cold. Now if you are using it for next patient, we should not be using that same fluid, because it is already very cold. It should not be poured on the skin, so it should be taken out from the direct operation room, so that it is not very cold that we should apply for the next patient. We should not do that. These are minute details, but these are very, very important, because pre-warming and hypothermia, maintenance of keeping the patient in normothermia, avoiding hypothermia is very, very important, because hypothermia is another cause of having SSI to a great extent. So maintaining, that's why it is being said, the guideline says, prior to surgery, all adult patients scheduled for neuraxial, general, or combined anesthesia are pre-warmed with a forced air warming device and on its high temperature setting for at least 10 minutes before if the surgery starts. So it's very, very important. This is a very good guideline which talks about how to maintain, why normothermia is so important to reduce the risk of infection, SSI. So appropriate skin preparation is one of another component where chlorhexidine, gluconate, and alcohol-based solution can effectively reduce the skin bacteria. So when the skin hand hygiene is being done or surgical scrubbing is being done, we have to ensure what sort of combination of products that we are using. So this is the right combination of products which are supposed to be used. Now, minimizing traffic in the operating room is another factor which is very, very important. As Dr. Pari was saying, that too many times opening the door when the surgery is going on is it's not recommended. Also, the number of people that they will be remaining in the operating room is very, very important. Because number of people depends on to minimize the contamination inside the OT. So when we talk, so this is the second factor. When we talk about this is part of intra-op. Now we talk about post-operative care. In post-operative care, it is important that proper wound care is being taken, which Dr. Bari has already mentioned. Prompt treatment and infections, that means right kind of antibiotic has been used in terms of the sensitivity pattern. And patient education, patient and family education is very, very important.